Okay, I'm going to continue on some client factors regarding Yolanda and her left upper extremity fracture. So patient education. Healing is usually completed in approximately 3 months' time. However, it could take up to a full year for the fracture to be completely healed. You want to make sure Yolanda knows this so she doesn't exert herself too soon and potentially cause more pain and more damage to the fracture site. This can delay healing and cause more complications. So some do's and don'ts for Yolanda. Do always ask for assistance if needed, and she can speak with her physician because he may be able to recommend an agency if she doesn't have any home support available, which for her she does. She has her husband and sons, but she values her independence, so she may not want to utilize her help. So it's important to let her know that it's better to ask for help than to injure herself further. And then some don'ts. Don't use the injured arm to push yourself up in bed or from a chair, because this requires forceful muscle contractions and can lead to complications. Don't overdo it, because as stated earlier, early overuse of the shoulder may compromise her recovery. And don't for surgeries, for after surgery. This doesn't necessarily apply to Yolanda, but it's good to know. Do not lift anything heavier than a glass of water for the first 6 weeks after surgery. And also do not put your arm in any extreme position, such as straight out to the side or behind your body for the first 6 weeks after injury or after surgery. You want to make sure that you're not going too far out to the side and then behind you, because you don't want to potentially cause any more complications with your fractures, or maybe even make your fracture worse. And lifting anything heavier than a glass of water is not recommended for the same reason. Physical agent modalities. So 2 modalities that I would recommend for Yolanda are cryotherapy, which is used to manage pain by decreasing the metabolism of the affected tissue, and thermal modalities. This also decreases pain and it promotes blood flow to the injured site. So now we're going to cover some of her context and environments. So, personal and temporal factors that may influence our assessment and intervention planning. Well, Yolanda values her independence, and she doesn't want to rely on anyone besides her husband. Her kids are heavily involved in after-school activities. Her husband gets home from work at 9 p.m. on weekdays. She volunteers in kids' after-school activities. She's fearful to try showering, even though her doctor has given her permission to do so without wearing her sling. She doesn't work. She enjoys traveling and entertaining guests. So, she values her independence and doesn't want to rely on anyone besides her husband. This may be somewhat of a problem since he doesn't come home until after 9 p.m. on weekdays. And also, her kids aren't going to be around because they're in after-school activities, so she'll be spending a lot of time home alone. So it's really important that she remembers her do's and don'ts and not to overexert herself while she's recovering. Okay. Some potential mealtime difficulties that she could have, since her left upper extremity is immobilized in a sling for the time being. She could be unable to cut her food with just one arm or with one hand. She could have difficulty scooping her food onto a spoon. She won't be able to wash the dishes one-handed. And what are ways that we can address these 3 problem areas? So, her inability to cut food into smaller pieces, I would recommend a rocker tea knife for one-handed cutting. That's this right here, the rocker tea knife. You can use with one hand, and in a rocking motion, you're able to cut your food. This I found for about $25 online, so it's not too expensive and it's recommended. For her difficulty scooping food onto her spoon, this one right here, the second picture, shows a scoop plate. So one side of the plate is curved up higher than the other to allow the client to use a plate to help scoop food onto their spoon. This product I found for about $5 at allegromedical.com. So it's not too expensive, and it'll really help with her unilateral eating. Another alternative to this scoop plate is just eating all her meals in bowls. This will help facilitate scooping the food onto her spoon and would make it easier for her, and it's more cost effective since she won't have to buy any new materials. However, the only downside is that this would require more dishwashing. The third picture down here shows Dysum. So she can put a piece of Dysum down underneath her plate to hold it still while she uses the rocker tea knife or her utensils with one hand just to ensure that her plate is stable and not moving around. You can also see back here that they're using Dysum to hold their cup in place. She could also use that, but she should be fine because her coordination isn't affected in her right upper extremity. Her inability to wash dishes, well, she could always ask for help from her husband or kids, but she is independent, so maybe she could utilize a dishwasher if she already has one. And so other potential difficulties that she could have once her sling is discharged from her left upper extremity include difficulties with coordinating both arms, eye-hand coordination of her left upper extremity, and also weakness in her left upper extremity due to being immobilized. Dressing difficulties. She's going to have difficulties fastening her buttons, upper and lower body dressing difficulties, and she'll only be allowed to use her right upper extremity to dress herself. And how would we address these difficulties? Well, we could teach her one-handed dressing techniques similar to how we would instruct a stroke patient. And we could also recommend some equipment. So the top picture is a dressing stick that she can use to help put on her pants, socks, and her pants and socks mainly. The bottom one is a button hook. So this one allows her to wear button-up shirts with less difficulty because the button hook will go ahead and button her shirt, and she could also use it for her pants. So the button hook I found for about $8 at Walmart, so that's a not too expensive option for her. And the dressing stick you can purchase for about $5 at Walgreens. So the dressing techniques, we would teach her to thread her left upper extremity into the shirt sleeve first, since she has limited range of motion, with pain, with any movement greater than 25 degrees of shoulder flexion, greater than 10 degrees shoulder extension, and greater than 110 degrees elbow extension. And when her sling is discharged from her left upper extremity, she's going to have the same difficulties as mentioned before. Okay, I forgot that I made this slide. So the difficulties after the sling discharge, as mentioned previously, gross motor coordination, eye-hand coordination, left upper extremity weakness due to immobilization, and she's also going to have potential loss of strength, endurance, and range of motion in her left upper extremity. So what are some safety concerns for Yolanda? Well, she is a fall risk due to that immobilized left upper extremity, and she's unable to bear weight on her left upper extremity for transitioning from sit to stand and supine to stand. So for this, you would just have to instruct her on how to stand properly, scooting to the edge of the chair first before she starts to try and get up, and maybe teach her some rocking motions to help her maneuver from sit to stand and also supine to stand. And driving is not going to be recommended until the sling is discharged and she can bear weight on her left upper extremity. This is just to ensure safety. So now on to some theory and evidence. So the biomechanical frame of reference is something that I use in developing intervention planning. So it's a remedial approach that focuses on addressing impairments that limit occupational performance. It considers joint range of motion, muscle strength, and endurance with an intact central nervous system. So it also focuses on muscle strength, controlled skill movement, quality of movement, endurance, etc. during occupations. So a fracture was caused by a fouche, or a fall on an outstretched hand. It's a physical impairment that will heal through immobilization and exercise to limit the amount of impairment to occupational performance due to left upper extremity immobilization. The evidence that I found to support this choice is found in Willard and Spackman. It explicitly states that the biomechanical approach is considered a remediation approach. It's focused at the client factor / impairment level when those impairments are limiting occupational performance. Examples of impairments that are addressed by this approach include weakness, limitation in joint range of motion, edema, pain, low endurance, sensory changes, joint instability, poor coordination, etc. Clients living with cardiopulmonary disease, various forms of arthritis, burns, cumulative trauma, repetitive strain injuries, tendon tears, lacerations, and fractures may be appropriate for interventions based on the biomechanical approach. And that sums up my part.